Good evening, everybody, and thanks for coming. It's a real pleasure to see a big crowd out to discuss what's a really pertinent issue, but to explore it from a really different point of view. And so, what I'd love to do is talk about social mobilization, and initially to pose the question, what is social mobilization, why does it matter? If you look in the news, you'll see a lot about treatment and care and control of the spread of Ebola. There's another piece to this puzzle. I think it's important that we're going to talk about three different elements that all combine in a holistic response to Ebola. You need all of them. None of these stand on their own. The social mobilization is simply empowering communities to protect themselves from Ebola. Most of the narrative these days, well, I want to get into that as you're going to talk about it. Why do we need to empower communities? Cass just said we're up to about 10,000 infections in West Africa, with 3 countries affected. And I think as we look at that, we go, well, how do we get to 10,000? It's important to think about mathematical momentum here. The first case was reported in March, which means the outbreak probably started way before that, a couple months before that. But as of mid-May, we were looking at 300 infections across Guinea, Sierra Leone, and Liberia. Now, 6 weeks later, it was about 500 infections. That was in July. Another 6 weeks later, it was 2,500 infections in August, and now we're up to 10,000. So the rate of growth has been about doubling every 4 weeks for roughly the last 10 months, right? And that poses a really serious question because there's just a mathematical momentum behind that. You can't stop it at zero, so already you've got 10,000 people infected. How do you slow that rate? That's really what social mobilization is about. As we look forward, we could be looking at 10,000 more a week. The fatality rate is rising from about 50% now to 70%. As the infection worsens. I mean, the ultimate worst case scenario right now, interestingly, the worst case scenario 3 or 4 weeks ago was 10,000 infections by January. The worst case, that was from the WHO and the CDC. The worst case infection projection now from the CDC is 1.4 million by January. And so imagine your kind of curve there, where you're looking at a projection of 10,000 going to 1.4 million in 3 weeks. That's the change. So this is the landscape that we're working in, and why a holistic response is really, really important. So how do you stop something like that, right? There's a whole piece here that's really important about treating people who are infected, about it's what you're seeing in the news, and all of that, right? However, there's a really serious reality on the ground. Everyone who's running a relief operation in Sierra Leone, Liberia, Guinea is running at full capacity, if not over capacity. MSF does not have space to take more people in, nor does the IRC, nor does the Red Cross right now, right? And so we see a lot of publicity coming out of the UK about sending a ship down that's going to have 200 beds. 200 beds out of 10,000 infected, right? The raw numbers mean that treatment alone won't end this. So we need to look at something else. So this is kind of painting the context for social mobilization. Hopefully I'll tell you something more positive now. Because it isn't just doom and gloom. We need to look at positive responses. So how do we drive this down? There's something in epidemiology called an R0, and an R0 is basically how many people the average person will infect if they're infected with the virus. Right? So the R0 for a flu virus is 1 to 2. For Ebola, it's around 2. For something like smallpox, 3 to 6, HIV, 2 to 9, measles, 10 to 18. So Ebola is very powerful when you're exposed. A small amount of exposure is enough to give you Ebola. However, you only express in certain windows during the period where you're infectious. So the actual R0 is pretty low, and that's a really good thing. So the trick in social mobilization is to contain that one period where you're highly infectious, which you drive the R0 from 2 down to 0. Sorry, a little mathematical start to the evening, and it'll get more NGO-y soon. And so how do we do that? Apologies to Mandy, who spent the day with me and the best minds at DFID last week looking at this. But basically, the first step is not to drive R0 to 0, it's to drive R0 to 1. And so you just flatline the infection. So right now, you're infectious potentially up to 21 days once you're infected with Ebola. Right? The epidemic won't be declared over until 42 days, 2 whole cycles without cases being reported. Right? Now, the average person, when they're infected, tends to express between the 7 and the 9 day window. On average, this is when you tend to be the most infectious, right? So you can imagine a bit of a curve here. If this is time and this is infectiousness, where you might come up like this, and then you see it kind of trail down, right? So how do we limit an R0? How do we drive the R0 down to 1 and to 0? There's 3 things that can happen. One is to bring forward the time where a sick person presents themselves to a hospital, to a medical provider, right? So they're not presenting at day 9 when they're really highly infectious. Perhaps they're presenting at day 2 or 3 when they're showing symptoms but not able to infect, right? Because this drives down one whole group. This protects people in the household, right? 99% of Ebola infections are people who are family members or healthcare workers. You don't get it just walking down the street. You get it from intimate, close contact. So by presenting early, you drive down the risk to people in the household. The second risk you drive down is to health workers, because they're less exposed, right? You're coming to the health center beforehand. And then the third one is an unfortunate one, but it's safe burials. So it's ensuring that Ebola isn't transmitted during burials. And I can answer any questions about how that happens later, but needless to say, these are the major risk factors for how Ebola is transmitted. So if you want to knock down the infection, what you need to do is sensitize and mobilize people to act quicker, to decrease these 2 risks, and empower them to bury their loved ones safely. Does that make sense? Cool, so what are we doing in Restless Development? How does that fit in? That's social mobilization. It's about behavior change. And so what are we trying to do to change behaviors? I'll give you a quick sense. And interesting, we were over at DFID on Friday, and they said, look, the most important thing right now is not scale, it's speed. We need people who can move now, be training now. Not in 2 weeks, not once all the logistics get into place. We need training now. If you think about that rate of growth, speed is more important than scale. We don't need to reach 10 million people in West Africa. We need to reach somebody. That's how you begin to flatten out that curve, right? So how do we get involved in Restless Development? Those of you who know us very well know that we're not a relief organization. We're not built for this. We do long-term sustainable development. We do it through young people's leadership, and we've been doing it for years. How do we get involved in something this urgent? How do I even know this now? Trust me, I didn't know much about epidemiology about 6 months ago. Not to say I know much now. How do we get involved? And I'll tell you what happened. In June, when again the infections were below 500 at this stage, we saw an issue in our communities. Our volunteers came to us and said, Ebola is beginning to be talked about in communities. We don't know what to advise our people. So we did something. We brought in 150 volunteers who were on placement. Volunteers, one like Laura, who was on one of these placements. We brought them in 3 days. We retrained them in how to do Ebola prevention. We sent them back out, and they ran a month-long program until their cycle ended. So I happened to be out in July doing the debriefs to watch and listen to these volunteers. And we heard countless stories of lives saved already. We were getting calls from villages saying, we knew what to do when so-and-so's uncle came into the village and the cases were spread. At that point, we were also talking to government saying you need to sensitize nationwide. They said, no way, it's just in 2 districts. And this is the kind of thing we're up against. It wasn't just government, it was all development partners as well. People who pay for this were saying it's not that big. And we're saying we're hearing it from volunteers in 4, 5, 6 districts now. So we mobilized that. Based on that initial success, we then went out and found a couple of partners who were willing to seed fund a rapid scale up. So that first scale, what we did is we went out to, in Sierra Leone we have about 1,000 plus former volunteers in our networks. We texted 300 of them in 4 specific districts where they were living. Within 2 days we had 200 applications for the volunteers we needed. We brought them in, and within August we trained them fully in how to do this kind of door-to-door, face-to-face work. And they went out. And so we're 4 weeks into that program. Over the 8 weeks, they'll be reaching 360,000 people in 4,500 communities across Sierra Leone. Now we're starting to talk about scale, right? So that's been very successful. And make no mistake, there's been huge challenges. We've run into huge challenges. Going to communities that have allegedly been, informed, they haven't even heard about how to respond. We're getting rocks thrown at our volunteers. We're having to pull them back out. We're having to go into the staff to make sure we can facilitate entry. And our people are working full-time, all the time, for about the last 6 months. However, that reach is now edging toward 500,000. We're now into the urban areas as well. So that was a huge success. Based on that response, now government has come to us, as have the development partners, and are asking us to lead the largest scale up. So over the next 2 or 3 months, we're going to recruit 1,400 volunteers and send them out to reach 1.4 million people in Sierra Leone. And this isn't megaphones off the back of the truck. This is door to door, face to face, village to village. So every day our volunteers get up, they put on some protective gear, they bicycle in or motorcycle into a community. They spend several hours with the chief, the paramount chief, or the local leaders to make sure that they're comfortable with what's going on. While that's happening, the town crier goes out and tells everyone else what's happening in the village, so that when our volunteers come out, they're seen as people who are welcome. And then they spread as many house-to-house messages as they can in the day. They go back, they take all the feedback. This is not about one-way message delivery, this is about a conversation. And understanding what the needs are of these people, what their fears are, what they're saying. Because they know there's a lot of social learning going on, there's positive responses coming up in Sierra Leone. Let's make no mistake. If left to its own, Sierra Leone, Guinea, and Liberia would solve this. Our only role here is to accelerate that, right? It's not about us flying and support. It's about us facilitating this kind of learning, speeding up the process. So that's happening. So every day right now we've got several hundred volunteers going out and they're teaching Ebola prevention. They're teaching how to re-enter. So people who are surviving, how do you re-enter your community and not be stigmatized? How does the community accept someone who's gone off to that horrible treatment center that we're all afraid of? How do we bring that person back in and make them part of the community again? We're doing child protection. Where over 5,000 children have been orphaned by this process, either orphaned or left behind. And we're also doing referrals and calling burial squads when we do come across bodies. So that's what's going on. When I say we, it's not me. It's 18 to 25-year-olds Sierra Leoneans who are volunteering to do this. I think it's so important that when we think about responses, it's critical that we send aid. It's critical that we fix a lot of how the international community is responding. But it's even more critical that we don't assume that it's something we have to do for them, right? We need to assume that locally led solutions are the most viable, the most valid, and ultimately the most sustainable in this kind of progression. So we've been really proud to do that, Justice, and it's been a huge learning curve for us. There has been some really sleepless nights for a lot of our team and a lot of hard work. I spoke to our country director, I speak to him every day. A couple weeks ago, he goes, Perry, this is the most important thing